Hey everyone, Dr. William here. Let's kick things off by talking about one of the most incredible organs in your body, your liver. Now, if you want a simple way to picture it, just imagine your liver as your body's ultimate, super efficient cleaning crew and detoxification plant all rolled into one. Seriously, this powerhouse organ is constantly working behind the scenes, processing virtually everything you put into your system, whether it's the food you eat, the drinks you sip, or yes, even the medications you take. Its main mission? To break down these substances, identify anything potentially harmful, and then efficiently get rid of it so your body stays happy and healthy. So, when we talk about medications, it's crucial to understand that they all go through this incredible internal processing facility. Your liver is responsible for metabolizing these drugs, transforming them into forms that your body can either use or eliminate. It's a complex, vital job, and when we introduce certain compounds, even common ones, into the mix, it can sometimes put an extra load on this incredible filter. Think of it like a busy factory line. Usually it runs smoothly, but introduce too many difficult materials, and the system can get strained. That's why understanding how medications interact with your liver is so incredibly important for your overall health. Alright, let's get real about medications for a moment. While they are absolute game changers, designed specifically to help you feel better, fight off infections, or manage chronic conditions, it's super important to understand that they aren't always entirely harmless, especially to your liver. Think of it like this. Every single medication you swallow, every pill, every capsule, it all has to be processed by your body. And who's the main processor in this intricate system? You guessed it, your incredible liver. Sometimes, even common medications that you might think of as completely benign can actually be quite demanding on your liver. It's like putting your liver into overdrive, forcing it to work extra hard to break down these compounds. In some cases, this can lead to what we call liver strain. And if that strain continues or the medication is taken in higher than recommended doses, it can even lead to damage. That's why being aware of what you're putting into your body and understanding how these substances interact with your liver is absolutely crucial for maintaining your long-term health. Alright, let's talk about one of the most common medications probably sitting in your medicine cabinet right now, acetaminophen. You probably know it as Tylenol, or it might be in combination with other drugs in cold and flu remedies. It's a fantastic tool for knocking down a fever and easing minor aches and pains, and millions of people use it safely every single day. But here's the critical point I need you to remember, because this is where the danger comes in. Overdosing on acetaminophen is a major cause of liver damage. This isn't just about taking an entire bottle at once, though that's obviously extremely dangerous. The real sneaky part is when you accidentally take too much over time, or you combine multiple medications that all contain acetaminophen without realizing it. For example, you might take Tylenol for a headache, and then later take a cold medicine that also has acetaminophen in it. Your liver doesn't care that they're different boxes. It just sees more of that compound to process. Exceeding the recommended daily dose, even slightly but consistently, can overwhelm your liver's ability to safely break it down, leading to severe stress and potential irreversible damage. So, always check your labels and know exactly how much acetaminophen you're taking. Alright team, let's move on to another incredibly common group of medications that many of us reach for regularly, NSAIDs. That stands for non-steroidal anti-inflammatory drugs, and you probably know them by names like ibuprofen, think Advil or Motrin, and naproxen like Aleve. These are superstars when it comes to tackling pain, reducing inflammation, and bringing down a fever. They're excellent for everything from a nagging headache to muscle soreness or period pain. But here's the kicker. While they're fantastic for relief, they're not entirely without their potential pitfalls for your liver. While NSAIDs are generally safe for occasional short-term use, the real concern arises with long-term use or when taken at high doses. Just like with acetaminophen, your liver is the primary organ responsible for processing and breaking down these compounds. When it's constantly bombarded with high amounts of NSAIDs, it can put a significant strain on its delicate systems. In some cases, prolonged or excessive use can actually lead to liver injury, even though it's less common than with acetaminophen. So, while these are powerful pain relievers, it's crucial to stick to the recommended dosages and talk to your doctor if you find yourself needing them consistently. Okay, let's dive into another group of medications that are absolutely essential for our health: antibiotics. These are the powerful drugs we use to fight off bacterial infections, literally saving lives every single day. From a simple strep throat to more serious conditions, antibiotics are incredible tools in modern medicine. But here's the catch we need to be aware of. While they're fantastic at targeting those nasty germs, some of them can, in certain individuals, cause issues for your liver. When you take an antibiotic, your liver gets to work processing it, just like with any other drug. However, some types of antibiotics are known to occasionally trigger what we call drug-induced liver injury. Now, I want to reassure you, this is usually temporary and reversible, meaning your liver often recovers once the medication is stopped. But it really highlights why it's so incredibly important to only take antibiotics when they are truly needed, as prescribed by your doctor, and to complete the full course. Don't push for antibiotics if your doctor says it's a virus, and never take leftover pills from an old prescription. Your liver will thank you for it. Alright, let's tackle another very common class of medications, especially if you're over a certain age or have a family history of heart issues: statins. These are the superstar drugs prescribed by doctors worldwide to help lower high cholesterol levels, which is super important for reducing your risk of heart disease and stroke. They work by blocking a substance your body needs to make cholesterol, essentially bringing those numbers down. And for the vast majority of people, statins are incredibly effective and generally very safe. However, because your liver is the primary organ responsible for both making cholesterol and processing statins, it's something we doctors always keep an eye on. While liver problems from statins are quite rare, some people can experience elevations in their liver enzymes, which are markers that tell us how the liver is doing. This is why, if you're on a statin, your doctor will usually recommend periodic blood tests to monitor your liver function. It's a standard precautionary measure, not typically a sign of serious danger, but it ensures that we catch any potential issues early and can adjust your medication if needed. So don't be surprised by those blood tests. They're just part of making sure your cholesterol is managed safely. Hey everyone, let's talk about antifungals. These are a really important class of medications designed to fight off stubborn fungal infections, which can range from something relatively common like athlete's foot to more serious internal infections. Fungi can be tricky to get rid of, and sometimes we need powerful medications, often taken for a longer period, to completely clear them out. While these drugs are incredibly effective at doing their job, they also need to be handled with a bit of extra care when it comes to your liver. The reason we keep a close eye on the liver with antifungals is that many of these medications are heavily processed by this vital organ. When you take them, your liver works hard to break them down and prepare them for elimination from your body. Because of this intensive processing, some antifungals, especially those used for more systemic or long-term infections, can sometimes cause temporary elevations in liver enzymes or, in rarer cases, more significant liver stress. This is precisely why your doctor will often recommend regular blood tests to monitor your liver function while you're on these medications. It's just another way we ensure you get the treatment you need safely and effectively, keeping that amazing liver healthy. Alright, let's talk about medications that help with our mental well-being. Antidepressants. These drugs are absolutely vital for millions of people worldwide who are managing conditions like depression, anxiety, and other mood disorders. They work by balancing certain chemicals in your brain, helping to improve mood, sleep, and overall quality of life. For many, they are life-changing medications. However, just like with other powerful drugs, there's a conversation we need to have about their interaction with your liver. While antidepressants are generally well tolerated and severe liver problems are quite rare, it's known that some types of antidepressants can, in very rare instances, impact liver function. Your liver is the organ that processes these medications to activate them, and then eventually remove them from your body. Because of this, doctors are always balancing the immense benefits of these medications for mental health against any potential, albeit small, risks. If you're starting an antidepressant, or if you're on one long-term, your doctor will weigh the benefits and risks, and may sometimes recommend monitoring your liver with blood tests, especially if you have other liver conditions or are on multiple medications. It's all about ensuring your treatment is as safe as it is effective. Alright, let's tackle a topic that can be a bit tricky, and honestly, a little misunderstood: herbal supplements. It's super common for people to think, oh, it's natural, so it must be safe, right? And while many herbs have incredible benefits, this is a critical misconception when it comes to your liver. Just because something comes from a plant doesn't mean it's harmless or that it won't interact powerfully with your body, especially your liver. Here's the deal. Your liver doesn't distinguish between a pharmaceutical drug and a compound found in a herbal supplement. It just sees a substance that needs to be processed. And unfortunately, many herbal supplements, some of them quite popular, contain active compounds that can be incredibly taxing on your liver, and in some documented cases, even cause significant liver damage. Think about ingredients like kava, green tea extract in concentrated forms, or black cohosh. These are just a few examples that have been linked to liver issues. This is precisely why it is absolutely crucial to always tell your doctor about any and all herbal supplements you are taking. Even if you think they're benign, they can interact with your medications. And more importantly, they can directly impact the health of your amazing liver. Don't keep a secret. Your health depends on it. Alright everyone, this next point is absolutely crucial, and it's a mistake I see far too often: the danger of mixing medications. Now you might be thinking about prescription drugs, but I'm talking about everything. Prescription medications, over-the-counter drugs, herbal supplements, even vitamins. Your liver is incredibly sophisticated, but it has its limits. When you start combining different substances, especially if they are all processed by the liver, you dramatically increase the burden on this vital organ. Think of your liver as a busy factory that has a certain capacity for processing materials. If you're only giving it one type of material, it can handle it efficiently. But when you start throwing in multiple types of raw materials, different medications, different supplements, all at once, that factory can get overwhelmed. This can lead to increased stress on liver cells, potential interactions between the drugs themselves, and ultimately, an elevated risk of liver damage. This is precisely why it's non-negotiable to always inform your doctor and pharmacist about every single thing you're taking, no matter how insignificant you think it is. They are the experts who can spot potential dangerous interactions and help you navigate your medication safely, ensuring your liver stays healthy and happy. Alright, let's talk about something incredibly important that often gets overlooked when we discuss medication and your health. Individual differences matter a lot. You see, while we can talk about general risks and common reactions, your body isn't a textbook example. Everyone's liver, and indeed their entire biological system, handles medications a little bit differently. It's not a one-size-fits-all scenario, and that's a crucial concept to grasp. Think about it. Factors like your age. A younger person's liver might process things differently than an older adult's. Your genetics play a huge role. Some people are simply predisposed to metabolize certain drugs faster or slower, or to be more sensitive to their effects. Then there are your other health conditions. If you already have underlying liver issues, kidney problems, or even conditions like diabetes, it can impact how your liver handles medications. Even your diet and lifestyle choices can influence this. This is why personalized medicine is so important, and why your doctor always considers you as an individual when prescribing and monitoring medications, rather than just looking at the drug itself. Alright, this next point is absolutely critical because knowing the signs of liver trouble can make a huge difference in getting help early. Your liver is incredibly resilient, but when it starts to struggle, it often sends out signals. These aren't always dramatic or sudden, so it's important to be aware of what to watch for. If you're on medications or just generally concerned about your liver health, paying attention to these symptoms is your body's way of telling you something might be off. So, what are we looking for? Keep an eye out for unusual fatigue. I'm talking about persistent tiredness that just doesn't go away, even with rest. Also, watch for nausea or vomiting that isn't tied to a stomach bug or a general loss of appetite. A classic, but often later, sign is dark urine, almost like the color of tea. And probably the most well-known symptom of liver issues is jaundice, which is a yellowing of your skin or the whites of your eyes. Less commonly, you might experience abdominal pain or swelling, especially in the upper right side where your liver sits. If you ever notice any of these signs, especially in combination, please don't hesitate. Seek medical attention immediately. Don't try to self-diagnose. Let a professional check it out. Early detection can make all the difference for your liver's health. Alright, we've covered a lot of ground today, looking at how common medications can sometimes impact your liver. But if there's one takeaway I want you to remember above all else, it's this: talk to your doctor. They are truly your best protection. In today's world of easy information, it can be tempting to self-diagnose or make assumptions. But when it comes to your medications and your health, the professionals are there for a reason. Never, ever hesitate to ask your doctor or pharmacist questions about any medication you're taking, whether it's a new prescription, an over-the-counter drug, or even a supplement. Ask them, are there any potential side effects for my liver with this? Are there any interactions I should be aware of? They have the knowledge and the tools to help you understand the risks, ensure you're using medication safely, and monitor your health effectively. Open communication with your healthcare team is absolutely key to keeping that amazing liver healthy and happy for years to come. Don't be shy. Your health is worth it.